So today we're going to talk about something really important for anyone taking care of an older adult: how to manage high blood pressure. We're going to walk through a great guide from DailyCaring.com and break down some super practical tips that can help you protect your loved one's health.
You know, there's a reason they call it the silent killer. High blood pressure, or hypertension, is tricky because it usually has zero visible signs. Someone can feel totally fine, but inside, serious damage might be happening. And that's exactly why we need to get a handle on it.
And we are not talking about a rare problem here. Get this, nearly 120 million adults in the United States have high blood pressure. That's almost half of all adults. So yeah, this is a huge health challenge that touches families all over the country.
But here's the part that's really eye-opening. Even though it's so common, only about 1 in every 4 adults with high blood pressure actually has it under control. That massive 75% you see right there, that's a huge risk for sure, but it's also a huge opportunity for us, as caregivers, to really make a difference.
Okay, so here's the game plan. First, we'll dig into what makes this silent killer tick. Then we'll get you set up with a management toolkit. After that, we'll dive into diet and exercise, cover some other key lifestyle tweaks, and wrap up with the most important part, the right mindset.
All right, let's start with part 1, explaining the silent killer. We need to get a really clear picture of what we're up against and why keeping it in check is absolutely essential for a senior's health.
So, at its most basic, high blood pressure is just what it sounds like. It's this constant, long-term force of blood pushing way too hard against the artery walls. I want you to imagine a house's plumbing system that's always running with the pressure cranked way, way up. Day after day, sooner or later, that constant strain is going to cause some serious wear and tear. And that wear and tear, well, it leads to some really scary stuff. As you can see, we're talking about a much higher risk for things like heart attack and stroke, but also kidney failure, vision loss, and even vascular dementia. This is why getting that pressure down isn't just a nice-to-have, it's vital.
I know, seeing a list like that can feel pretty overwhelming. It's totally natural to think, okay, this is serious, but what on earth am I supposed to do about it? Well, that is exactly where we're going next.
Okay, so let's build your management toolkit. We're going to start with 2 foundational, non-negotiable steps to really get a handle on this. It all starts with a simple rule. You just can't manage what you don't measure. So step 1 is to get a home blood pressure monitor and use it regularly. Step 2 is just as crucial. Make sure medications are taken exactly as the doctor prescribed. On time, every single time. No skipping doses, period. And here's a super simple but really powerful tip. Just grab a notebook. Write down the date and the reading every time. This log isn't just for the doctor. It's for you. It's motivation. You can literally watch the numbers go down and see your hard work paying off. All right, once you've got the monitoring and medication down, we can start building on that foundation. This next part is all about the game-changing power of daily diet and exercise habits. First up, maintaining a healthy weight is a huge factor. But what's so encouraging is that you don't need some dramatic, life-altering change. For someone who's overweight, losing as little as 10 pounds can make a real, significant difference in their blood pressure readings. How great is that? So how do we support that? Well, the game plan is pretty straightforward, and these 3 habits work together perfectly. First, focus on whole foods. Fruits, vegetables, the good stuff. Second, and this is a big one, seriously cut back on salt. And third, make sure they're drinking plenty of water, which helps the body naturally get rid of extra sodium.
So when we say use less salt, what does that actually look like? Well, the American Heart Association gives us a really clear target. Try to stay under 1,500 milligrams of sodium per day. That's a great number to keep in your head when you're checking out food labels at the store.
Now let's talk about getting moving. The goal here is consistency, not crazy intensity. The recommendation is to aim for at least 2.5 hours of moderate activity every week. If you break that down, it's just a little over 20 minutes a day. Totally doable, right? And that activity doesn't have to mean hitting the gym hard, not at all. It can be super accessible. A nice brisk walk is fantastic, whether it's outside or even just around a mall. There are also tons of great short programs designed for seniors that you can do from a chair or that just focus on balance.
Okay, moving on to our 4th section, lifestyle adjustments. Because beyond just diet and exercise, a few other key changes can have a huge impact on managing blood pressure.
Let's talk about 2 of the biggest culprits, smoking and too much alcohol. The link here is direct. Nicotine literally makes your arteries tighten up and raises your blood pressure right away. Alcohol does something very similar. Cutting back, or even better, cutting these out, is a massive win.
And we absolutely cannot forget about stress. Think about it. When you get stressed, you can feel your body tense up. Your blood pressure goes up too. The key is finding healthy ways to unwind. This could be anything from relaxation exercises to getting lost in a hobby like art or gardening, or even just doing a crossword puzzle. And finally, let's not forget the basics. Getting enough good, quality sleep is one of the pillars of a healthy life. It's when we're in that deep sleep that our body does its best repair work on our heart and our blood vessels. It's so important.
And that brings us to our final and maybe most important section: progress, not perfection. This is all about the mindset. It's about your role as a supporter, as a cheerleader, in building a healthier future together.
I just love this quote because it sums it all up perfectly. This is a long-term journey. There are going to be good days, and there are going to be not so good days. The goal isn't to be perfect overnight. It's about making small, smart choices over and over again. And your encouragement? That's the fuel that keeps them going in that marathon.
So what's the big takeaway from all this? It's simple. Start small. Don't try to change everything all at once. Just look back at everything we've talked about and ask yourself this one simple question. What is the first small victory you and your loved one can achieve together? Maybe it's just a 10-minute walk after dinner. Maybe it's trying one new low-sodium recipe. Just start there. Celebrate that win and then build on it. Thanks for watching.